Hi, everyone. Welcome back to Leadership and Culture First, where we discuss the complexities of leadership and culture, but also offer solutions to aspiring new and experienced leaders. We invite guests to share their knowledge and experience and ask those challenging questions. As coaches, we aim to provide real insights, enable reflection, and challenge thinking. Join us on our mission to unleash your leadership potential. Welcome back, everyone, and thanks for joining us for this episode. Today, Nikki and I are absolutely delighted to welcome Claire Pryor. Claire is a first in our professions. Claire is the RCN Foundation Chair and Professor of Adult Social Care Nursing. This role is, like I say, the first of its kind. And Claire is based at the University of Salford, but works with the RCN Foundation. Claire takes a strategic lead in shaping research and education in adult social care at a local and national and also international level. Thank you so much for joining us, Claire. We get to learn a lot more about what you do. So I'm looking forward to this. So first of all, Claire, how did you get to where you are now?
How did I get into this job? I think it comes from having a very curious mind and always feeling a bit of an internal drive or on a bit of a treadmill of needing to feed my brain and needing to be doing something really innovative for me or really exciting or things that don't necessarily come naturally to me. So I'm a registered nurse, I'm a registered adult nurse, and have been for many years. And I did what predominantly most nurses in UK nurse education do. I went to university, and upon qualification, I got a job in a medical assessment unit within an NHS trust. And I worked for many, many years on medical assessment units before moving to intensive care. So I was that adult nurse running around in scrubs with beeps and pumps and infusion devices. But I was always really interested in the evidence base and the questions behind why am I doing something? What's the biology? What's the chemistry? What is the influence of the actions that we're taking? And I ended up being called by one of the senior charge nurses on the intensive care called Questioning Claire, because I wouldn't shut up. I just kept on saying, why am I doing this? What does this inotrope do? How can I do this? What happens next? And the doctors used to do like little quizzes with me and put up x-rays and get the British National Formulary out and try and test me to I think they were trying to trip me up, and quite often I just didn't know the answer, but it fed this little knowledge monster within my head. And I started to think at that point, what do I do with myself? I've worked in these really high-paced, technical environments, and I really enjoyed it. I'd done a master's in advancing healthcare practice, so I'd learned all of this theory about models of service design, and I just felt like there was always there's always something else. I always have to be on a course, or I always have to be doing an extra little bit aside from work. But actually I started to reflect and think, gosh, what I found really most satisfying, and I hadn't really recognized it at the time, was whilst I was doing my nurse training, I worked in a care home for 3 years. And that sense of being with people day in, day out, really getting to know them, really getting to know their family, helped me plug the knowledge I was gaining as I was training to be a nurse, or being educated to be a nurse, around the biopsychosocial, the well-being, into an individual's life and their personhood and their sense of self, but with theory and with practice and with biology and chemistry and nursing skill. So I went on another little journey with myself into the community, worked in intermediate care and did my history taking and assessment qualifications and finished off my master's. And again, my little brain monster started talking to me saying, well, you finished all of these courses and you feel quite happy with the work that you're delivering. What are you going to do next? And at this point, I was a junior sister, so I was part of a team, and I'd started leading those teams and being responsible for for the care that was being delivered whilst I was on shift. And I ended up being an older person's advanced nurse practitioner, or a specialist older person's nurse, but within a mental health trust. So I took myself even further out of my comfort zone and went and worked in a mental health hospital, working on wards for older people who couldn't have their needs appropriately met in the community. And then I started doing a PhD and started getting even more into research. And it's questions, isn't it? It's asking questions, trying to find solutions and answers, but also supporting the teams that I was embedded within, supporting the other nurses, taking them and maybe teaching them about some of the conditions that they didn't know, or just being a bit of peer support for them, and being someone that they could call upon and ask questions of whilst I was asking questions of them. And I went to the university and started working full-time at the university, teaching and educating our wonderful pre-registration nurses whilst doing my own research. So again, just where is the question? Where's the interesting thing we don't know? What little adventure can I go off on to find out answers to really pertinent practice-based questions? Which very fortunately for me took me back to that kind of soul of my practice when this job came up to be a professor of adult social care nursing. And it's wonderful because it means I get to work with an extraordinary team of nurse academics, sociologists, clinicians, practice-based nurses, regional support teams, and other organisations and institutions to do what I love doing, asking questions, getting answers. But then for me, really importantly, what do we do with the answer when we've got it? And taking that back to the people who want that question answered. So everything's been driven by this little internal brain monster always needing to have its questions thought about and answered.
Brilliant. No, that's really great to hear. I think what's really interesting, we were chatting, just for listeners, Claire and I were chatting before this podcast. And Claire, you said how you don't see yourself as a leader.
Not particularly, no.
Yeah, talk to us
No.
about that.
Yeah, that's not. You're not the first person to say that comes on this
absolutely.
podcast.
Yeah,
But you are on a leadership podcast for a reason. So how come you don't see yourself as a leader?
I think it's got something to do with how we define leaders, and that, and I know it's something that's often spoken about, so I'm not going to go into it, but leadership and management are very often bracketed together. And I think when I think of a leader with a capital L, you think about somebody in a position of a organizational structure or a power dynamic. And I don't think I am or should be that. I do think I can get a gang together. And I do think that as a gang and as a team, I get the privilege to do really, really good and interesting work. And sometimes I see things in a slightly different way to what other people see. And other times I need to sit back on my heels and, as my mum used to say, take a deep breath and a big step back and look at the big picture and see things from other people's perspectives. But I think it's for me, it's the term leader just doesn't quite, for me personally, sit very comfortably. And it's probably because of the way that nursing's traditionally laid out. My colleagues and I have discussions about nursing hierarchies and the whole organisation of healthcare practice and how it is quite hierarchical. And I want to be in the middle of the team. I want to be, in the gang, and each member of that gang has a different strength. So they will lead in different fields or different elements, and then we all come together to bring our product together or to bring our ideas together. And I do know, and I do acknowledge that there sometimes has to be a figurehead, or there has to be somebody with the responsibility for driving, or a kind of a point of contact. But I think our strength is in collaboration and knowing where everybody else's strengths and talents lie. That was a very roundabout way of saying it, wasn't it?
No, it's an honest truth. Do you think there's a difference between our hierarchical structures within NHS care and those of social care and community care that enable people to look at things differently when it comes to leadership?
I do think so. And I'm not saying one is right and one is wrong, but it's an observation that we have that actually in social care nursing, where my interest is, there is perceived to be a lot more scope and a lot more freedom and a lot less hierarchical structure, which allows people to jump off and go on exploratory career journeys and move around a little bit more and get engaged with really interesting project or innovation or enterprise in a slightly different way.
Yeah. How should we bring the two together? How would we help? Because it is health and social care. That's what we talk about all the time, is health and social care. And one is not more important than the other. And they are really, really important interlocking services. So how should we bring those two together effectively?
I think it's very, very challenging because there's a sector structure which does place divides in terms of communication pathways, employment, governance, and policy. And I do think there needs to be it started and it is ongoing, this really robust opening of doors. And when I say people coming together and talk to each other and getting around a table, I don't mean in a kind of a tokenistic point of view. I think it really is about people hanging egos up at the door and just sitting down and saying, do you know what, we need to learn from each other, and we do need to really, really make efforts from both parts of the sector to understand what the other one does and what the strengths are and where the elements are that we can support and bolster and share innovative ideas. But there are legal and technical infrastructures in place that does make that difficult to cross over. But from a practice and a practitioner point of view, it is about really open discussions, really open narratives. One of the things I've been incredibly fortunate to be part of was the inception of the Social Care Nurse Advisory Councils. So the SNACs, as we named them, your snack councils. So in England, there are 7 regional councils chaired by social care nurses who meet monthly or bi-monthly with all of their wonderful social care nursing colleagues, but then also the regional ICB chief nurses to bring together this very open talking situation, and they work on key strategic priorities for their region, leveraging kind of both sides of that infrastructure. And I think that's a really powerful way of showing what can happen, and getting social care in front and center, looking at their innovations, looking at the way that they're doing work around proficiency and competency development, looking at communication strategies, looking at really innovative areas of nursing practice in social care, and how the NHS or the ICBs can integrate that to pull the two together. And I think as we go into looking at neighbourhood models of care, that's going to become more and more important to get the fusion of those two sectors really well ingrained.
So now I'm listening to all of this, Claire, and I just feel like I need to take on a bit of a mission to enable you to recognise what a leader you are. I feel like, I really do. Genuinely, I feel like, right, I now need to sit here and coach Claire into recognising her amazing sort of leadership. So there's one thing I just want to take you back to, I'm really, really interested in, was about, you talked about getting your gang together, getting your team together and knowing each other's strengths. So what is it then about that enables you to do that? How do you go about that?
I don't know if I've thought about it consciously, and I'm incredibly fortunate in the position that I'm in now, that the gang is this really well established gang. People knew or aware of each other before, and we've grown our gang. And I think it's about just being welcoming and not having a predetermined idea of who that gang should be. You have your core members, so kind of the key members of staff who that is their role, but then just keeping your ear to the ground and being really, really open and receptive to maybe hearing somebody's name or hearing about a bit of work that they're doing and going, do you know, that's really interesting. But come and join our gang. And just being enthusiastic and just heard I've been listening to Rebecca talk at the RCN Foundation about compassionate leadership, and something she said really resonated with me, and I've been working really hard because I'm not very good at this, but to listen with fascination. And I thought, when I heard her talk about that and the theory of listening with fascination, I recognised that sometimes, and my gang very rightfully laugh at me because I'm not very good at this, I get distracted really easily. And I need pulling back into that space of listening with fascination. So I've been actively, over the last 6 months or so, really trying to make an effort to turn things off on other screens, really, really focus. And when people mention a project, an idea, a passion that they have, to think almost like a little bell goes off in my head and it's like, listen, Claire, zone in and give them all of everything that I've got. And I think that brings people along with you because you are listening, you are engaging. I'm not very good at it. Sometimes my brain does go off on a little tangent. I can't help it. I have to pull it back into the room again. And that's my journey and that's my learning I need to go on. But I can recognize that. But I think if somebody really does listen to your idea, if I think about when I was on medical assessment or intensive care, when you're trying to explain something to somebody and they shut you down, how small it makes you feel and how that can sit with you and it can derail the rest of your day. And your idea might be fantastic, but if you get shut down really quickly, it hurts, doesn't it? It creates an injury. And if somebody just gives you that time, gives you that space, really lets you communicate what it is you want to say, I think that does so much for their own self-esteem. And there might be that interconnection. There might be that little bit of something that you want to explore further with. And they might become part of your gang, or you might signpost them to another gang. You might say, do you know what? That's amazing, but it's not quite the right fit for here. But do you know what? Dave 2 doors down would be fascinated to hear about it. Yeah.
I think it's interesting what you say there, because that small comment can set up the leaders of the future, because they will remember how people have behaved to them and how they want to be. And I think we all remember as we go through nursing who we want to grow up into and who we don't.
Yeah.
We really don't want to be.
Mm-hmm. Definitely. And I think we've all been there, haven't we? We've all got people in our backpacks. I think nurses carry around backpacks of people we've looked after and people we've worked with, and we'll remember times that have been so wonderfully empowering and so wonderfully influential in our journeys, and people you just think, oh, I really want to be like you. How do you do it? And we remember times when we've come across people and we think, I don't want to be anything like you. I want to do it completely differently. But I think, again, to quote one of my gang, wonderful woman I work with, she's such a inspiring person. Sometimes when we're in that situation where somebody isn't as warm or as time giving as we would have liked them to have been, or maybe they're a bit short, or maybe they've communicated in a way that's made us feel, like they have hurt us. What's the context and what's the intention? And I think thinking about things using those two frameworks, and I'm not going to claim this is mine, it's not mine, it's a wonderful lady that I work with's idea that she shared with me, context and intention. And no, it's not okay that you felt like this, but actually, what was the circumstance? What was the timing? What's happening with them? And then I suppose it resonates because I would always like to think that I give people, as I'm trying to, my undivided attention, my listening with fascination. But I also know when I get stressed, I shut down and I can become really directed. My mind works in black and white boxes. So I like everything in my world has to be a bullet point list, a black and white flow chart. If it's not in a box, my brain doesn't process it. And when I get stressed, that's what comes out in my verbalizations. I will become short and really precise. Maybe I come across as dismissive or disengaged, and I don't mean to, but it's just because there's a million different things happening inside my head. And I think I hope, or I reflect back and think, I know that there will have been times where I potentially have made other people feel not listened to, not heard, shut down. So what do we do to recognise that and not have it happen again in the future? So understanding the way my mind works and my stress levels, and trying to put proactive strategies in place so I can listen with fascination and I can have time, even if that's to say to somebody, I know you really want to talk to me about this. It sounds like a really good idea. Can we do it after lunch? Can we do it in half an hour's time, rather than just pretending to listen and not actually listening? Yeah.
So I'm going to highlight then yet another good leadership thing is you've got self-awareness. So by the end of this podcast, you'll leave, Claire, and be like, yes, I am a leader.
We'll give you a badge that says I am a leader. You can stick that on there. Maybe we should do that.
Maybe we should, yeah. But yeah, and I think the things you said about self and recognizing your kind of potential responses to others, I think that's such an important leadership trait to even think and to reflect. And I think what makes good leaders are the people that do that reflecting, and think about all of those sorts of instances. So yeah.
People who lead in different ways. So in the gang, we might have someone who's really, really creative. So they naturally become the person who we all turn to, or is the creative leader. We'll have somebody who is kind of, I suppose I'm the process leader, and I'm also the one that likes to draw the diagrams when we explain things. But it's about leading by not letting other people, that's really bad language, isn't it? Leading by understanding where other people's strengths are and them taking the leadership in areas that resonate with them. And then teaching other people how to have the skills that they have. So everybody gets brought along at the same time.
That's a really good point, actually, is that there doesn't have to be just one leader in a room or in a team. There can be more than one leader that surfaces at different points.
Yeah, everybody leads with different opportunities in different ways for different reasons. And they might be leading because they're learning to lead, or they might be leading because it needs a very specific skill set, or they might be leading because it's the weekend, but it's not about this is the only person that can do this. That's so dangerous and so unsafe. It needs to be an ecosystem that can grow and breathe and thrive as a collective. I think. That's the way I think about it. And everybody feeds in and plugs in different strengths and talents and support mechanisms for that ecosystem.
Yeah. And with the work then that you do in your, I'll use your word, ecosystem, that you want to take forward, I know you're doing some great local, national, international work. What's the kind of culture you're hoping to create around the work that you do, around how you want to move things forward in adult social care? What are you trying to do?
I think it's about parity. It's about optics and making sure that for my work that I'm doing, and again, this isn't them or us or anything's better than anything else. It's about unpicking and leveling up the awareness of nurses working in social care are nurses. They have NMC pins. And unfortunately, we do know that our nurses who work outside of the NHS in social care settings, so care homes or home-based social care nursing, we know they feel very unseen. And we know from research and from anecdotal information that quite often they're treated as if they're not a pin-holding registered nurse, which is desperately wrong and quite sad because they have exactly the same education skills, whether they are educated in a UK setting, whether they come to us having done extensive education in other countries, and then they've done our training as well, and converted onto the NMC. We need to celebrate and we need to recognise the wealth and knowledge of skills that our nurses in social care have, and put that on a level playing field. So when you hear nurse, you hear nurse. And when you hear social care nurse, the bigger collective audience understands that the social care sector and the social care side of that naming convention means that they're a nurse who happens to work in a social care field of practice. A bit like when you say cardiology nurse, you know what a cardiology nurse is. When I said I was an intensive care nurse, you knew exactly what that was, and neither of those prefixes made you think I wasn't a real nurse. So it's about not having people seeing the social care environment as detracting, because actually it enhances, it celebrates. They look after the most complex levels of intertwined health and care and social well-being. And I think the variation of their roles isn't high enough in the collective consciousness. So predominantly, if I say a social care nurse, people will think care home and they'll think older person's care home, and they won't understand that actually, yes, it is care in care homes or their own home for people who are older. But it's not just because they happen to be chronologically older, it's because they have complex multimorbidity, frailty, long-term conditions, and that's physical health and mental health, or learning disability needs, or they have, this whole suite of requirements that needs a registered nurse to be able to plan, treat, execute, care provision for them. It might be younger working age adults with serious and enduring mental health conditions. It might be people who are across the age span who have care needs that need a registered nurse because they have a learning disability or an acquired brain injury or a complex neurological condition. And the level of complexity and specialist field practice is so high, but it isn't recognised and it isn't seen. They look after people on ventilators with tracheostomies and total parental nutrition and, all of these technical terms that you think, oh, NHS, how can that happen? It does. It happens every single day. But the optics don't necessarily make it as visible as it could be. So my role is about digging into the research, understanding what it means to be a social care nurse. So we've just published our first definition of what a social care nurse is. And then how do we support and leverage their knowledge and skills and talent to really shine a spotlight on that work, especially with going into neighbourhood models of care. That can't just be, acute and secondary care integrating with primary care NHS services. It needs to be that the social care nurses are seen as a fabulous resource, and they are, really where the heart of neighbourhood sits with our populations, especially with the health needs at the moment.
How do we get these amazing leaders in social care? Because that's what they are. They're dealing with complex care, complex integrated systems. How do we get them more in front of our newly graduate nurses, or even younger than that, our nurses that are coming through at 16, 17, 18, who are thinking about it? Because they see on the television the critical care nurse, the emergency care nurse, but they don't see the social care nurse. And that nurse, as you say, is leading in their own way.
So there's a massive drive at the moment. So Skills for Care have published a placement strategy for undergraduate pre-registration nurse training. And there's been a very strong steer from Department of Health and Social Care, Deborah Sturdy and others, that nurse education needs to have placements in social care settings to change that optic. We don't want nurses graduating without understanding that nursing doesn't just happen in the NHS. And I say that, across multiple different services as well, and it is about, in some respects, the universities broadening their horizons when they think about where a placement can be, and thinking about when you are doing things like we are at Salford at the moment, looking at our curriculum, inviting the social care nursing leaders or the social care nurses to come in and inform that curriculum. I think it would be fantastic, and lots of other people have said this. We need a soap opera set in a care, or a soap opera.
Yes, please.
Or a soap opera set in a domiciliary care service, something like that. Because you're right, when we think about healthcare, we think about other TV programs do exist, Casualty, Holby City, don't we? We think about the accident and emergency department, but actually that's a very worthwhile but very tiny snapshot of the whole system. And I think it is about people who are organising, running, setting up groups, looking at how we deliver or educate nurses to make sure that we do have equal representation across all of the different settings. The independent health and social care setting, yes, it's social care, but actually the independent healthcare setting as well sits in there. So, private practice for nurses sits across that too, and making sure that that's recognised as a viable career option. So I think it's about the people with the organisational power making sure that they really do sense check their inclusion processes when it comes to representation of the whole social care and kind of nursing workforce.
I think you're absolutely right, though. I think there's something that we should be making a plea to the BBC, and other channels are available.
I know.
To do that social care programme, which is informed by the nurse leaders and informed by people to say this is what the reality of it is, to show our young people that it's a fantastic place to be.
Yeah, absolutely. Absolutely. And such innovative career options. And also the other thing that I do want to draw people's attention to is sometimes, and I do mean sometimes, not all the time, sometimes people think that NHS care will be better than social care nursing provision because we see the rating charts and the charts. And I do think people should go and dig down a bit to the data around that, because actually there's not that much difference. In the 2025 reports, which you can look at on the internet, they're out there for everybody to see, there are social care nursing services which actually come out with better metrics than some of the acute settings. And this, again, it is not them and us. It's just about that balanced approach and that viewpoint. So if we are going in with assumptions, that we check them, and that we actually, if we're saying that it's not a real nursing role, well, it is. And actually, you have to be an NMC nurse to call yourself a nurse in a nursing home. And you have to, your CQC rating, where does that sit in comparison to some of the other sectors? And I think it's just changing our lenses a little bit needs to.
Yeah.
This is a person who leads in social care, Sharon, and she'll never admit it. I don't know. We're not going to get her to do that.
Okay, we'll get her a badge. We'll send it to her. Thank you. We'll send it to her. Okay. I mean, thank you. I mean, this is absolutely great. I think one of the things that we do on this podcast is we have a question for our guests, but we're doing it slightly differently today, aren't we, Nikki?
We are, because this has come from a listener or somebody that actually has sent me a question. So I'm going to ask you a question here, and we'll give you some time to ponder that. Mm-hmm. But the question is, how has your sense of leadership changed as you lead, as you've led the work around social care? As you've come out of the NHS into social care, has your sense of leadership changed?
Yes. Very definitely. And I think it's about the organisational cultural shifts that have happened across social care and the NHS. But from my own personal point of view, seeing the way that social care nursing services are set up and operate is very different to NHS. And I think when you're in a leadership position in the NHS, it is very structured. There is a very upward set of stairs and escalator. And in social care, I think what I see is people taking on leadership roles because of their talent, because of their skill, because of their potential to grow, and being afforded that permission to grow at a much earlier stage. And I think that is to be celebrated. So it's not based on how many years you've got in service. It's based on your natural acumen and your natural skills, but also where people can see your skills developing. I think there's a lot more freedom to kind of let people, in a protective and safe way, with a lot of support, let them develop, let them spread their wings a little bit more instead of kind of, having to go this very structured route. And that's not saying, again, one's not better than the other, but I think there is a freedom in social care. So for me, I think that's rubbed off on me. I think in this role, I am afforded a lot more freedom to see what's interesting, see what needs to be done, see who should be in the gang, see who would like to be in the gang, see who doesn't want to be in the gang anymore, and wish people well, and be really interested in where they've gone on to next. So I think there is this loosening and this opening up, especially for me personally. I think there's been times where I've been stuck in thinking, no, I have to do this. Has to be me, and taking quite a lot of burden on board with this has to be me. And now it's a bit like, no, it's us. It's opening it out, and actually this doesn't need to be me. It can be you. Do you want it to be you? Would you like it to be you? How can we help that if that's something that you want?
Yeah, that's giving lovely. Other people opportunities is great. Thank you.
Yeah, super. Now, question for you, Claire. What are you going to ask our next guest? We're not going to tell you who it is.
I don't know who the next guest is. No. So my question for whoever is next is, what do you do when you recognize that your natural leadership style jars with the person that you're trying to lead? So when your natural leadership style or your leadership personality clashes, I'm not sure if I like the word clashes, but isn't congruent, doesn't gel with what the other person needs.
That's a great question.
Really good. Yeah. And that'll apply to, lots of different people. So, brilliant. Thank you so much, Claire. It's been an absolute delight speaking today. Anything else from you, Nikki, that burning question to ask Claire?
Maybe just one.
Okay.
We've had a guest on here, a lady called Janet Schreier, who was one of our previous podcasters, who talks a lot about social care, has a lot of passion, but she's a private provider and not a care home, because it's so much wider than that across social care. And I was just wondering, what are the opportunities across social care for private and commercial providers that can work really effectively with the policymakers, etc., to move forward our deliveries and our opportunities?
I think it's for those private providers should absolutely be front and centre in moving the trajectory of where we're going forward. I think it's about, we would help them connect in with either their social care nursing council, if they're a nursing care provider, or connecting in with their local authority or leadership groups to showcase the work that they're doing, and then contacting the universities and really selling their skills and their talents and showing people, and then sitting in that policy space, trying to get in touch with some of the steering groups and policy influence work that's happening.
Thank you.
Brilliant.
Thank you very much. I'm sure she's going to be really pleased to hear that. So
You'll
be inundated with people contacting you now. Thank you, Professor Pryor. Thank you.
Yes, thank you, Claire.
Thank
it's,
you.
like I say, been an absolute delight. Really lovely to get to know you a little bit better. So thank you very much for your time today. And thank you to all our listeners for tuning in. If you haven't already done so, please don't forget to like and subscribe. And we look forward to you joining us again. Thanks, everyone. Take care. See you soon.
Thank you.
Thank you. Bye.